These new testing sites come as retailers and restaurant owners attempt to get back to business. So is the Valley ready to move forward? Here's Channel 5's Rudy Mireles.
Just under 7,000 of the Valley's residents have been tested for coronavirus. That's equal to about 0.48% of the entire Valley. These are the number of infections by day in the Valley. Cases dropped after the mid-April peak, but over the last week we've seen the numbers start to bounce up and down. Over the last several weeks, we've seen new testing sites pop up around the area. As tests became available, we saw a steady stream of cases. While elected leaders and healthcare officials watch those numbers closely, the Dean of School of Medicine at UTRGV, Dr. John Krause, says that although testing more people is important, the rising number is expected.
The number of people tested is really a function of how many test facilities you have. What's the volume of the testing you're doing? If we do more testing, we're going to find more cases, and that simply is a matter of testing more people.
Even with cases expected to rise, Dr. Krause says targeted testing, for example for healthcare and other essential workers, as well as contact tracing, will be key to stopping the spread.
We need to have the workforce out there to really track down anyone they may have been into contact with, isolate them, test them. That's how other countries such as South Korea really got ahead of this, by good testing, widespread testing, good contact tracing. And I know we're putting all of those systems in place right now. And during this month, during May, you'll see all of those really start to scale up here in the Valley.
As part of Governor Abbott's plan, both contact tracing and testing rates are expected to rise, ramping up to perform 15,000 to 20,000 tests per day statewide. To hit phase 2 of the plan on May 18th, the governor and his team plan to look closely not at testing and positive cases, but at hospitalization and death rates when deciding to move forward. Dr. Laura Rudkin, Preventative Medicine and Population Health Professor at UTMB Galveston, says that is the right approach to take.
And they've really been more reliable indicators in this pandemic than have positive test cases, because we don't really know who we're testing. But we're very clear about who's being hospitalized and who's dying, relatively speaking. So we can identify those numbers more easily, and we know roughly what those numbers mean for hospital planning.
Both doctors say that while people shouldn't be afraid to leave the house, they shouldn't let their guard down either. Dr. Krause added, while it may not be mandatory, wearing a mask, utilizing social distancing, and avoiding crowded areas for the foreseeable future is the right approach for everyone to stay safe. In Brownsville, Rudy Mireles, Channel 5 News at 6.